Hi, I'm Danny Gasparini, and welcome to this segment of Penn Voice. I'm joined today by Karen Pfister, who is a supervising epidemiologist. Before I go, Karen, into anything longer about who you're working with at this moment in time, please explain to our viewers what you do as an epidemiologist.
So the short answer is we analyze a lot of health-related data for the county. A lot of different data sources: birth records, death records, hospitalizations, emergency department visits. We also analyze a lot of data around reported communicable diseases that we get information from doctors and laboratories. So a lot of the work that we do is surveillance, just trying to kind of get a lay of the land. You know, what's happening in the county? Is there an increase in a certain disease or a decrease in another disease? Around communicable diseases, we're looking to see, is there something that indicates there's an abnormal number of cases of a disease that might be an outbreak situation? And then we work, if there is, then we work with our communicable disease staff to try to control the outbreak. So we do a lot of different things. We also analyze a lot of data that then can inform programs that we do within the health department or policies that are made. We provide a lot of data that goes outside of the health department to different community-based organizations. Sometimes people are applying for a grant and they want to kind of know, you know, they want to have some data in hand. They want to be more evidence-based. Right. So we provide that kind of.
So then, in this case, San Mateo County Public Health is your partner, or they're actually coming to you as an epidemiologist and saying, we want to understand XYZ outcome. And it could be disease-based, it could be health outcome-based, and then you're taking their data, what they've collected within their systems, whether it's from some of their public health initiatives, whether it's from their hospital, wherever they're gathering their data, and you're looking at that to sort of come up with some general outcome-based evidence.
Right. That is part of what we do for sure. We definitely are taking data that's already been collected and we're analyzing it, so it's secondary data. But sometimes we're involved with collecting data up front from a survey, for example. We actually just recently finished, a little over a year ago, a big health and quality of life survey that was done in the county that we collaborated with different hospital partners on. And so we provided a lot of input on the design of the survey and the questions that are asked to make sure they're valid questions or ones that it would, you know, people would be able to answer properly, that are validated against other surveys. So we do some of that as well.
So is this related then to what San Mateo County is launching in their new online data portal?
Yes. So this new online data portal is called smcalltogetherbetter.org. We launched just last fall, and we really want it to be a one-stop shop for people to be able to access data, health-related data, data around diseases, other demographics about the county, to really multiple different things to inform people so they know, have a sense of, you know, whether it's the general public going on the website, and it is accessible to everybody, so not just folks internally within the health department, but people we collaborate with externally, the general public. So if people want to have a better understanding of what is health or the health-related issues in San Mateo County look like, there's a place for them to go to do that. There's a lot of data up there already. That the company that we worked with to develop the site provides a lot of data, and I think there's about 200 indicators right now, but our goal is to continue to add data and information to that site as we move forward.
So something that you had said struck me. We're going to also post the website as you and I are speaking so that people who are watching our program can actually see the website that they can jump on to look at some of these data points and some of these reports that you're talking about. You had mentioned that users, individual users, so if I live in Redwood City, and I want to find out about some air quality data in my community, I can go on to this website and look at what are the data points in Redwood City and San Mateo County with regard to health initiatives around air quality. Is that a correct statement that you can drill down as far as your own? Or if you just want to know about your county in general, your community in general, you can also look at more broad-based health indicators?
You can do both, actually. You can look across at the county level, but you can also drill down. And we have a number, to try to make it as easy as possible for people to access the data on the site. We have a number of different ways people can get at it. There's like a simple search bar. There's a thing where you just click like find data. And there's also, for the data that we have available at the city level, we actually have icons of the different cities. So all you had, if you wanted Redwood City data, you just click on it and it will pull up all the data that's relevant to Redwood City. Some data is not available at the city level. It's just not collected that way. But what we do have available, yes, you could pull up at the city level.
And as I understand, it goes more than beyond sort of health initiatives or community health. It goes into socioeconomic indicators as well. Explain that a little bit further.
Yeah, so there is information on things like education and income and poverty, because it's people, when they think of health, obviously think of diseases, and that information is certainly on there. But there's other factors that drive health. It's people talk about the social determinants of health, those things I just mentioned, education, poverty, income. And so to be able to really have a full picture of health across the board, you need to have information on those factors as well. So there is that information there as well to have you help inform what really is going, what are the drivers of the health within our county, and what does poverty look like? Where are those pockets of poverty in our county? And then how might that impact what we're seeing for disease outcomes?
So are you linking then the social or the socioeconomic piece then to health indicators also through this site?
Yeah, you can, and you can map it. You can't necessarily overlay them on the same map, but you could produce maps and you can see, okay, here's where the pockets of poverty are, and then here's where certain disease outcomes are, and does that overlap? And for the most part, yes, it does.
So what would be the overall goal of the county wanting to produce such a data online tool?
I mean, I think it's many different things for different people. Some people, need information. As I think I mentioned earlier, they're maybe writing a grant. They want some evidence-based data to support that.
So organizations like nonprofits or community hospitals.
Exactly. Like I was just speaking with someone yesterday that was using the portal. They're one of our healthcare districts, and they're trying to figure out what their health priorities are going to be for the upcoming year. And so they actually went on, and you can also pull data by zip code. So that's what they did. They looked at the zip codes that they cover for their healthcare district, and they pulled as much data as they wanted, and they looked at across the board and kind of figured out, based on the data that was there, what are the issues for our particular healthcare district.
Well, since you are a data collector by trade and by schooling, will you then look at the usage of this site to predict any kind of either program change or social change or delivery of service change by people actually getting data and knowing what to do with it?
I think that's probably our long-term goal. It's hard sometimes if it's not people internally, if there's just folks externally pulling it, we may not know who they are or what they're doing with it. But I will say there's actually also a space on there for people to reach out to us, because obviously data is data, but to really have understanding of it and be able to interpret it, that's a whole other thing.
And where it came from and how
the limitations. And so we actually have a way for people to reach out to the epidemiologists in my program. So if they need help in understanding it, then we can provide that support. And then if they want help even with, tracking it and doing some evaluation work down the road, we can also help support that as well.
So we just have about 30 seconds left. What do you want to leave our viewers with, ensuring that they know that, one, this data portal does exist and that everyone has access to it? And I think everyone's going to be very curious to sort of look at what are some of the things that are out there for San Mateo County. What do you want us to take away from?
I think just really knowing that it's there and certainly helping to spread the word. We've been trying to kind of advertise it to the folks, we collaborate with, but just really get that information out there that this exists, and there's a lot of information. And also, if there's information people are looking for that's not on there, like to let us know that, and we can see, do we have a data source that maybe we just haven't been able to upload it yet, but is there something that's missing that the community really wants?
Well, Karen, thank you so much for coming on Penn Voice. And we'll, of course, have shots of the data portal so people can see what it looks like and how to access information and website, and then obviously your contact information if people want to learn more. So thanks so much for bringing this announcement to us. I know I will be jumping on the portal site right after this interview. So thanks all of you, and I hope you're doing the same thing too. See you next time on Penn Voice.